Let's bring in the Premier CEO and President, Susan Devore. Susan, good to see you. Thanks for joining us.
Thank you.
Premier works with 76% of U.S. community hospitals, 130,000 other providers. You've got a real sense of what's happening here. What was your reaction yesterday, and where are we in this battle, in your view?
You know, my sense of this is, if this were a baseball game, we were kind of in the second inning of the game. We were winning by 1 run. We've been distracted by the brawl on the pitcher's mound. Unfortunately, it's our own team in the brawl. And we need to get back to the work of improving healthcare, improving outcomes, improving costs, and quit having this total repeal and replace discussion every time the political winds change.
But what are you going to do? I mean, the public wants it repealed and replaced.
Right. I think what the public wants is for it to be improved. They want costs to go down. They want it to be safer. They want it to be coordinated. They want their information to be transferred. I think you can fix all of that incrementally, and we ought to get back to that work.
So they also want the mandates to be removed. They want a lot of the taxes to go down. They just want easier access, lower premiums, not the headaches, and an economy that functions properly.
That's right. And I think if you go back to 2010, Medicare growth has averaged about 4% a year. If you go all the way back to 1969, which was right after Medicare was implemented, it's averaged 7.5%.
Wow.
So I think progress is being made in these value-based payment provider delivery reforms, the way hospitals and doctors interact with patients and the way they take responsibility for the total cost of the care. And that's the work that we need to get back to. But, you know, this question of insurance and access to insurance, that's one part of what the ACA was. The other part was, how do you actually fix the healthcare system, which is what Premier is focused on.
Is technology a huge part of that? Because I would think it has to be. It makes doctors' jobs easier in treating patients.
Right. Technology is a huge part of it. We've come a long way because we now have electronic medical records in most places. The challenge we have now is all these data systems are not interoperable. It's another way, instead of talking about a huge repeal and replace, let's go to work on making the data interoperable and forcing standards so that healthcare providers have to share data and technology companies have to allow it. But it is a big issue.
This is one perspective. But I think it would also be fair to say that this is the perspective from insurance companies and large hospitals and being focused on their costs, and it's not necessarily the perspective of patients and doctors. If you're a patient, you're now seeing that instead of the exact same treatment from the exact same doctor is now costing more because that doctor has had to go be part of a larger hospital. Or if you've had a knee replacement or a hip replacement and you need to go in for gallbladder work 2 months later because of this bundled payment system, the hospital doesn't want you because this is now being treated as a problem of costs. And everything is being looked at. The euphemism that the insurance world uses is value-based pricing, which means good care for a particular price, not the best care that you, the individual patient, might actually need or want. It's some third party deciding this. And I think a lot of people are a little bit worried that while this sounds good, if you're looking at it from a cost perspective, from the insurance company or hospital company perspective, it's not addressing the fact that you've got this record shortage of doctors, that the growth in hospitals is coming in administrative staff, and that you've got disincentives for maybe the best quality care. So how would you respond to those concerns?
It's clear the incentives aren't aligned and they need to be fixed. It's clear to us at Premier that you have to fix this from the inside of the healthcare system, not the outside. I don't actually think government or insurance companies can fix this. I think consumers with transparent information and choices together with their physicians and their healthcare systems. I'm a mom, I'm a grandmother, I have, huge extended family. What I want most is a local healthcare system, has all my information, the information's connected, I can choose the doctors I want to go to, and I understand the cost, and I think the cost is relative to...
So you would favor transparent pricing for doctors as well as hospitals?
I favor transparency, we favor data interoperability, we favor all the incentives around these value-based programs, because what they do is they actually reward or punish healthcare systems and providers based on their quality and their safety and their outcomes and their cost. Because there still is a lot of duplication, overuse, underuse because of the disconnectedness of the system.
Yeah, really great insight, Susan. Thanks so much.
Thank you.
Good to see you. Susan Devore, Premier.